Welcome to the office.
Thank you.
What brings you here?
I am experiencing neck pain, and I feel like I need to crack it
All the time?
all the time.
You wake up stiff in the morning?
Yes.
Okay. You throughout the day it gets a little bit better, gets tight at the end of the day then?
Like around 2, I just feel so uncomfortable sitting down. And then
Okay.
I'm just squirming around trying to find comfort.
Are you working at a desk?
Yes.
Okay. So you're sitting most of the day working.
The whole
You're on
day,
a
yeah.
computer and a phone, I'm assuming?
hmm
Okay. Are there any other things going on? Just so I have a background.
My breathing, I have asthma. I
Okay.
do take a controller for my
Now
asthma.
the asthma, you've had it since when?
Birth.
Since birth.
Yes.
So you've had this asthma since birth. Is it a wet or a dry asthma?
At least before I got on the controller, it was wet.
Okay, so wet means you were producing a lot of mucus.
Yeah.
Okay.
It was just like popping up, and I was just constantly spitting.
And you're not here for me to fix this, but I want to explain the physiology behind it and the mechanism neurologically, okay? So we have our trachea, right? We have this trachea, we have our windpipe. The windpipe goes into the lungs. The trachea has an opening in the back, and I'm using my hands for simplicity. So this is the breathing pipe, right? Right here. The back of it, it's like a horseshoe. There's a muscle on the back there called the trachealis muscle. Okay? It opens and closes the trachea. That is controlled by the sympathetic nervous system. The sympathetic nervous system, we'll explain in more detail later, is part of our fight or flight. It's the nerves in the middle of our spine. Okay? Now, we have all these glands around the inside of the trachea. They're mucus glands. Okay? So, when we breathe, what happens? Those glands warm up the air, right? Give it a little bit of humidity so it's easy to diffuse into the lungs. If the muscle in the back is tight, the trachealis muscle should be, let's say, like this, doing its job. Let's say it's stuck and in spasm. What does it do to the opening of the trachea? Closes it, causes a breathing issue. That is a dry asthma, sympathetic issue. A wet asthma is when those glands inside are producing too much mucus and it's causing closure of the airway, causing a wet asthma. Now, that is a parasympathetic control. That usually comes from the upper cervical, okay, the neck. This is just what they have seen. This is what Gonstead had seen in his 55 years in practice. You know, he documented a lot of this. We're not fixing asthma. That's not what we're doing, but I'm just giving you the neurology based on Dr. Gonstead's work. And you'll let us know. Maybe something does happen, maybe it doesn't. We don't know. Okay?
Yeah.
But I want you to understand that. That's controlled up here. We'll start at the base of the neck. Relax your shoulders, please. Good. Okay, so we're getting a reading on the top left here. Do you see that? It's consistent now, right there. Starting around the third cervical. That's around the around the fifth, sixth thoracic. See how it's consistent? It's not a big one, but it's there. The skin tone is different there. So as we're running it, I'm pretty sure we're going to get something here too. And it doesn't have to be a huge one because it could have been there for a while. What we're looking for is tissue changes, texture changes, color changes, and pain. That's tender.
Oh, yes.
That doesn't feel so good.
No.
That feels okay?
Better than the other part, but
How
it's
about
still...
here?
No. Oh, right there.
More here?
Yes.
Or more here?
Oh, the first, right there.
T5 major nerve supply, liver, gallbladder. Head down, which would also cause headaches and pseudo migraines. That doesn't feel so hot either, lady. I don't actually think I'm going to even be starting in the neck today. Honestly. It's not coming from there. Top of the joint. Good. Middle of the joint. Yeah. It's a little tender there too, right?
Oh, yes.
So middle and bottom's not really moving well. Left SI joint, T12, T5. This is a 24-story building, right? 24 movable bones in the spine. Stuff in the neck, upper back, whatever's going on up here. But if we don't have a level foundation like a house, none of this is going to hold. Does that make sense?
Yeah.
So we're gonna work on the foundation of the house. We're gonna work on 12, we're gonna work on 5. You will also tell us the difference in your neck just from what I do here. It should change. You're okay?
Yes.
Are you comfortable?
Yes.
It's a little weird, I know, I'm ASEX. We wanna bring it down and in. There it is. Nice. T5 PRS. 1, 2, 3, 4, 5. Chin up. All right, let's get a little bit more of this T5. There. Still a little bit. Drop the shoulders. There you go. 4, 3, 2, 1, 12. PRIT. Let's do it this way. Hold on. Now, as soon as it comes up, give it 3-4 seconds.
Uh-huh.
Let the body reset. 2, 3, 4. Go ahead and walk it off. Now you can tell us the difference. Straight line this
Oh
way.
my goodness.
You can breathe a little better too, right?
Yeah. Oh my goodness. I could like. You could just feel like I could breathe from both nostrils. That's so cool.
We didn't touch your neck, did we?
No.
Nice. Have a seat.
Wow.
Pretty cool, huh?
Yeah. Oh my goodness.
Now, let's make sure you see it changed. It's still there, but it's different. You see that? Now, we did T5. T5 is clear. T12 is clear.
I'm
What?
so like shocked that I can breathe. Like it feels so much more clear. Like just being able to breathe. Like wow.
But
like
you didn't come here for breathing.
no,
What did
not
you
at
come
all.
here for?
My back and neck pain. I feel so.
How does your neck feel?
Oh my god.
I didn't touch your neck.
It feels so. It feels. It's so cool. Thank you so
You're
much.
welcome.